Good afternoon, everyone. Thank you for being here with us today. I want to welcome you to the Spring 2024 Resilience Series. My name, for those of you who do not know me, is Hanari Wifai. I am the director of the Hurricane Resilience Research Institute at the University of Houston. I wanted to also welcome our co-sponsors of this series for the Spring 2024, and that's Population Health. That's led by Dr. Bettina Beach. Population Health is a university health initiative ensuring quality health and good health and improvements in health for everyone. I also want to welcome our founding faculty from the Climate Health Group at U of H. We are a newly formed group of 20 plus faculty, and we're trying to address the challenges at the interface of population health, natural hazards, environmental equity, and climate change. Our first speaker in the spring series is Dr. Elena Kraft. We're delighted to have her. She is president of the Health Effects Institute. She holds a PhD from Duke University and is adjunct faculty at multiple universities, including UT Health Sciences Center, Texas A&M University, and she's also a Kinder Fellow at Rice University. Today, she will present a national scale assessment of climate and health vulnerabilities. So, Dr. Kraft, take it away.
Thank you so much. Okay, so I think you all should be able to see the slides, but let me know if not. First off, I'd just like to say that I'm really grateful for the opportunity to be able to present to you all today. We've had not done a ton of work with the University of Houston in the past, but definitely have engaged with a number of you all, and really appreciate the collaboration and the work that I think we're all trying to move forward in various ways, particularly around climate and health and air pollution issues, particularly to some of those most vulnerable communities. So, and thank you, Hanadi, for organizing and for the invitation to do the presentation. I guess I'll start out. So I am new in my role at Health Effects Institute. I became the president back in August of last year after Dan Greenbaum retired after about a 30 or so year tenure. So I have definitely big shoes to fill. But prior to that, I spent 15 years at Environmental Defense Fund leading the climate and health program. And so much of the actual research that I'll be presenting today is actually from my time at EDF. And then, but I'm going to tell you a little bit about Health Effects Institute and some of the ways in which I'm trying to move the ball forward with regard to climate and health and air pollution. So first off, let's see if these, okay. So just a little bit about Health Effects Institute. We're a little over 40 years old. We're in many ways, like EDF, we're a very unique organization. We have, our mission is really to provide independent science on the exposure of and health effects of air pollution. This is really from a policy perspective. The funding originally for Health Effects Institute came from EPA, as well as some of the auto manufacturers. And the reason for that is that the auto manufacturers, there was some distrust, I would say, between the auto manufacturers and EPA around the time that EPA was releasing regulations around tailpipe emission standards. And so HEI really grew out of this desire for an independent body to review the latest science, to invest in the latest science around transportation-related air pollution. Since that time, the organization has grown. It's grown to include an energy program, which is basically looking at whether, are there community exposures, health effects, what are the cumulative impacts from unconventional oil and gas development. Similarly, this work is jointly funded by EPA as well as industry. And then we have some global initiatives that are looking at primarily low and middle income countries, trying to build capacity in those areas and looking for ways in which we can support work regionally that could help serve as a foundation for policy and decision makers in terms of air quality standards and protections. I guess one of the things that we've noted over the years is that really when you're talking about various countries, one of the most important things to remember is that they really like to see data from investigators in their own country about their own people, about their own residents. And so coming in with data from the US or from Europe and places like Southeast Asia doesn't really go that far in the policy conversation. And so we've been investing in some of those areas to try to build up the evidence to support, that ends up supporting, I think, some of the air pollution policies that are moving forward. And we have a big impact. I'll just say that because of the robust nature of how HEI operates, I think of it as kind of a peer-reviewed process on steroids. We identify in partnership with our stakeholders research priorities for each of the various programs, whether it be transportation and air quality or the energy program or the global health program. We determine those jointly. We develop RFAs to address some of those research priorities. But then we really turn it over to an independent research committee to evaluate the proposals that come in and to select the proposals for actual funding. We then, along with the research committee, as well as some of our staff, assist in overseeing that research that occurs. And once it's completed, even do a really robust review of the work for that particular investigation or progress. So, at the end of the day, you've got some of the most robust scientific evidence that could be done, that could be completed around the topic. And I myself can say that it really stands up, the work that HEI Fund really stands up to the highest levels of scrutiny with regard to decision making. I've testified in front of Congress a number of times relying on HEI funded data, and really stands the test of time and the highest levels of scrutiny. So it's really a great model. And you'll understand why I'm talking a little bit about this model when we get a little bit further in the presentation. So when we talk about climate change, I think one of the things that's near and dear to my heart is really climate and health issues. And I think you're probably all aware of many of the climate-related hazards that exist with regard to health. And those are coming from, extreme weather events. They're coming from heat-related mortality, sea level rise, air pollution, vector-borne disease, increases in incidence, water scarcity, reductions in food availability and production, and just a number of factors. And when you think about who's vulnerable to those health risks, it's really those who are, lower socioeconomic status, lack of access to health care, demographic issues with assessing how close they are to facilities and so forth. And so it really is, it comes down to trying to understand more about who is the most vulnerable and how can we address some of those vulnerabilities. Now, when you think about the weather and climate disasters, I'm sure all aware that since around 1980, the United States has sustained 376 weather and climate disasters where the overall damages or costs exceeded $1 billion. If you add that up, aggregate that over the last 40 or so years, that's more than $2.5 trillion on climate and weather disasters. Just in 2023, there were 28 climate weather disasters with losses exceeding $1 billion each in the U.S. And they range from, drought events, flooding events, severe storm events, wildfires, ultimately leading in deaths across the nation, and obviously significant economic effects. We have seen this number of climate and weather disasters increase over time. From 1980 to 2023, the average number of events was 8.5. The annual average for the last 5 years is over 20 events per year. So we're just seeing, and those are adjusted for inflation. So we're seeing a concerning trend, obviously, in terms of the implications of these disasters. I wanted to talk specifically about, one of the primary ways that that climate and especially weather events are influencing public health is through wildfire events. We're seeing an increasing trend in wildfires globally. This is a figure from a recent paper looking at the global trends of forest loss due to fire. This is just through 2019, so it doesn't include some of the large-scale fires that we've seen just in the last couple of years. But you can see that over the years, there is an increasing trend in wildfires. And part of the reason why this is so concerning on the health side is that the implications of these fires are that they are essentially leading to a very large reduction in the quality of air that we're breathing in areas where the particulate matter from these fires is going. And so if you think about just Chicago last summer, one day in July, Chicago literally had the worst air quality in the world due to Canadian wildfire smoke. And so when you think about the implications of this, and you think about all the policies that we're putting forward with transitioning to electric vehicles, with cleaning up our power plants, with addressing emissions from oil and gas development, the entire slew of protections that we're investing in around the country and around the world, essentially getting wiped out by the increase in pollution coming from events like wildfires. And these, in some cases, can be sustained. In Canada, there was, I don't have the exact reference, but they had over 100 days last summer where the air quality index exceeded that was so essentially unhealthy for individuals. And that's just, something that is a concerning trend for sure. So what are we doing about it? Well, one of the things that we focused on early on at EDF was really trying to understand what are the different elements that contribute to disparities in terms of exposure, particularly to those who are most vulnerable. And in partnership with Texas A&M University, several years ago, we actually developed the Houston Galveston Brazoria EnviroScreen tool. And basically that tool was much like Cal EnviroScreen. It was much like the screening tool that was developed in Michigan, much like the tool that's been developed in New Jersey and Washington and other parts of the country, where basically the idea is that you integrate, you aggregate a lot of different data sets to try to get a better picture of what is contributing to overall vulnerability. And in the case of HGB and virus screen, the domains that we focused on there were health, social vulnerability, flooding, environmental sources, and then environmental exposures and risks. And we were able to, the nice thing about the tool that we developed was that it essentially used a ToxPi model, so a toxicological prioritization, to identify what is really driving the risk at the census tract level. When we put this project together, one of the reasons that we had done it was because we wanted to have a scientific basis for being able to say that some areas were more vulnerable than others for particular reasons. So we wanted essentially that scientific evidence supporting the need and the advocacy around additional investment and support to those communities. And the very places where we thought we would see high scores in terms of vulnerability were the exact places that showed up in this index. And so it was really helpful for many of the communities that we had been working with to be able to pinpoint exactly those areas that were contributing to some of their vulnerability. After we had done the HGB and virus screen, we started thinking about, well, this is great, but it doesn't really factor in some of the climate issues, and it doesn't factor in some of the infrastructure. It doesn't factor in the access to healthcare. It doesn't factor in all of those baseline vulnerabilities and the climate change risks that exist. And also the HGB and virus screen was just the Houston-Galveston region. So we use the HGB and virus screen essentially as kind of a base model, and we expanded it nationwide, and we expanded it to include baseline vulnerabilities around health, around social and economic indicators, around infrastructure indicators, and environmental indicators. And then we also included those climate change risks, so extreme events, social and economic risks, and then health risks associated with climate change. When you add up all of the indicators that we incorporated into this Climate Vulnerability Index, or CVI, we had over 180 indicators. And this by far is the largest compilation of indicators of this nature that to our knowledge is out there. And we did the same process in terms of the ToxPi model, where we were able to look at what was really driving the vulnerability in the areas, again, at the census tract level across the nation. And this was really, I think, a labor of love. I mean, there are over 700,000 census tracts across the country. And so, being able to have this level of granularity with regard to these indices was something that had not existed prior to this project. And some of the findings from the original paper that we published on the CVI, I think really pinpoints one of the main finding, which is that no matter where you live in the United States, you are vulnerable to climate and health impacts for any one or more number of different reasons. So if you're in the, Midwest, you might be more vulnerable because of drought or because of extreme weather events. If you're in the South, you may be more vulnerable due to underlying health conditions. So it doesn't really matter where you are. You are being impacted at the individual level or census tract level, if you want to say that. And the notion here was that we thought this would be a good tool that would give power to some of the smaller areas to empower them to say, hey, our area is more vulnerable because of XYZ reason. Maybe we should prioritize investments in infrastructure or in our healthcare centers or in whatever is driving that underlying vulnerability. That was really the intention there. And just wanted to point out here that we looked at the outcomes of the climate vulnerability in context of other vulnerability tools that are out there, such as the CGEST tool that the White House released a couple of years ago. There are lots of different ways in which the CVI tool is different from other tools that are out there, but just suffice it to say that the CVI is the most comprehensive one that's been published to date. And then again, just looking close to home, we did the same type of analysis trying to identify where in the country are we seeing those highest levels of vulnerability? And I think it's no surprise that many of our neighborhoods that we all work with quite a bit, Fifth Ward, Sunnyside, are showing up with very high indice scores in terms of those vulnerabilities. And then, the purpose again of all this work was to really drive change. And so one of the things that we did originally was to look at climate vulnerability and identify opportunities through the IIJA or IRA. So some of the landmark legislation that came down, I guess, I don't know, close to 2 years now, that could be identified to help support investment in each of these regions. And we basically looked at all of the programs where funding was available from that legislation and identified the purpose and intent of those programs in correlation with the categories that we had in our CVI. And the purpose of that was to help communities be able to make the case for funding through the IIJA or IRA mechanisms to help say, hey, our census tract is more vulnerable than any other census tract in the country. We should really be a priority for funding through these mechanisms. It would be a scientifically sound way to make the case for funding to these most vulnerable groups. And so just looking at use cases, as I mentioned, just community action planning, advocacy around environmental justice, prioritizing disadvantaged communities. Justice40, as you're all probably aware, of the directive that benefits from IIJA and IRA should be targeted toward those who are most vulnerable in terms of environmental justice communities around the country. And then thinking also closer to home in terms of permitting and consideration of cumulative impacts. Do you really want to put another cement batch plant in an area where they have one of the highest vulnerabilities, looking collectively at all of the risk factors, is there somewhere else where it would be better choice for that facility? So thinking about all the different ways in which we might be able to make changes. I'm not sure if this is actually going to work, but I'm going to try it. We had the paper that came out, I believe is right in the beginning of 2023. There's a lot of attention around the paper and the CVI, and everyone wanted to be able to drill down and look at the numbers and what did it mean for their community specifically. And so what we ended up doing was investing in essentially a database that made all of the data were already available, publicly, but when you're talking about the volume of data that we had, so 184 indicators, 700,000 census tracts, it's just, you need a lot of computing power to be able to process that kind of data. So what we did was we partnered with a group called Dark Horse Analytics to essentially have a platform that anybody can access the data and be able to parse out whatever indicator or group of indicators that they would like to do more of a deep dive. So maybe, I don't know if this is coming up on your screen, but when you go to this website, what you can see is that through the different indicators, you can actually check the box for example, under the health domain, you could check looking at overall physical health. You could add in mental health and despair. You could look at infectious diseases. And each time you would end up with essentially a different map that provided a different set of information. You could also look at this at the state level, at the EPA regional level. So you could actually change the geographic area that you wanted to study. Also look at counties and so forth. And then you could also actually look at use cases for how the data could be used in either a proposal for funding, what areas research gaps might be identified, so it could be a hypothesis generating tool. Lots of different opportunities to use this CVI. And because the original intent was to provide a resource and tools for environmental justice communities themselves, we have a webinar that's embedded into the website that essentially is a tutorial about how a group or organization could use the data and essentially what it means, how it might be used in terms of trying to secure additional resources to address some of the vulnerabilities that are listed in the index. So circling back to how this is all related to what I'm now doing at Health Effects Institute. One of the things that I really want to see is, in the process of working on the CVI, I think we noted that there are a lot of research gaps in terms of the, and I'll stop sharing screen here, but we noticed that there are a lot of research gaps that are out there in terms of the data around some of the indices that we were looking at in the CVI. And so a couple of examples, things like child and maternal health. Data around the country on child and maternal health is really, there's a paucity of data. Different states collect the data differently. There's no good, there's not, I think, as robust of data sets as we would hope to have in the country that's available to be able to assess any trends in child and maternal health. Things like water quality are also, I think, a big gap in terms of data. Again, some states not reporting water quality data at all, some reporting, not in the same ways. So thinking about the underlying information that's being used to make decisions, I think there are a lot of areas where we would like to see increased support for and better quality data in those areas. So at HEI, we're in the business of providing funding to address research gaps that are essentially policy relevant. So, in my mind, I can't see more policy relevant data than understanding more about the health implications, particularly around air quality, around a changing climate. And given the extreme weather events that we've seen, the increase in heat, the increase in air pollution as a result of both heat and of wildfires, I think it's critically important that we have the capacity and the ability to investigate different areas and understand more about where we might be able to, invest in mitigation or adaptation at this point. Figuring out where could we really make a difference in this space. So I guess I will, and so that's kind of the overall plan, is that we would like to, I would like to, in my role at HEI, be able to identify a prioritized list of research gaps that exist with regard to climate and air pollution specifically, and then to fund that work so that it can be used as the underpinning in policies directed toward addressing the increasing number of adverse health outcomes that we're seeing because of a global climate. To that end, we are planning a climate and air quality summit that will be held prior to the next WHO Air Quality Summit, which will be held in Ghana in October of this year. And the idea is that if we're able to develop a prioritized list of research, then WHO can take that into their air quality summit, which is where they bring together ministers of the environment from many different countries around the world. And they all, make decisions about different types of resolutions, different types of ideas about how they might address some of the challenges with regard to air pollution. And then using that as essentially foundation for conversation at the next Conference of Parties meeting, which is that international body where issues around climate change and commitments are made by countries to address emissions, greenhouse gas emissions globally. So, a lot of ambition here, and we'll see how far we do, how well we fare. But we're very, invested in trying to understand more about how we can contribute and how we can produce the highest quality research to assist in developing the best policies that we can to address climate and air pollution.